Welcome to the BioBalance Healthcast, episode number 401. We're going to be talking today about the 4 types of depression.
BioBalance Healthcast features conversations about positive aging. Your hosts are Dr. Kathy Maupin, Medical Director of BioBalance Health and a leading expert in treating symptoms of aging, and Brett Newcomb, a licensed professional counselor. Dr. Maupin and Brett are the authors of The Secret Female Hormone, the seminal work about hormone replacement therapy for women, which is available on Amazon or from Dr. Maupin's office at BioBalance Health. Dr. Maupin's office is currently accepting new patients.
When I began practice, the new antidepressants called SSRIs that increased serotonin and made people not depressed was a panacea. It came out and everybody had to be on it. Everybody wanted to be on Prozac. It was a miracle drug.
Yeah, it was new stuff. It replaced the MAOI inhibitor as a primary antidepressant, and it replaced the tricyclic drugs.
And those 2 drugs are really difficult to be on because you can't eat certain foods and there are so many different risks.
Side effects,
and side effects. So most of us didn't prescribe them because as primary care, which was what I was considered as an OBGYN, we didn't feel comfortable prescribing them. So for somebody who was suicidal, we would send them to a psychiatrist and we wouldn't treat them ourselves. But when the SSRIs came out, the side effect profile was very low. And we learned about these literally, not from a book, not from a lecture, not from a conference. The drug reps would come in and say, here's a new thing. And you just give them this dose. And it was like one size fits all and everybody's happy and they don't gain weight. It was kind of, it's non-addictive. And it increases serotonin. And then they told us serotonin was, when serotonin's low in your brain, that makes you depressed. And that was like the only kind of depression they talked about.
Right.
So we all jumped on the bandwagon.
Because SSRI is serotonin reuptake inhibitor.
Which
it's a way to regulate the amount of serotonin that stays in what's called a synaptic cleft.
between 2 nerves.
The gap between 2 nerves, and it's filled with liquid. And messages, chemical and electronic messages, go from the end of one set of nerves over to the receptor side on the next set. And the medium that they swim through is primarily serotonin.
That's their communication. So there's serotonin in your brain, there's dopamine in your brain, there's epinephrine and norepinephrine in your brain, there's also endorphins in your brain. They're all chemicals that communicate different things. You know, when I was in medical school so many years ago, it was 40 years ago.
It was like having a channel select.